Awesome. Welcome, Amanda, to the Wellness Platform. So excited that you were here. How are you today?
I'm great. How are you? Thank you for inviting me. I'm very happy to be here.
Yes, I cannot wait for you to tell us all about yourself and how you
Of course.
transitioned from pharmacy school into the pharmaceutical industry. So, why don't we start off
Yes.
by you just telling us a little bit about yourself? Who are you?
Okay, yeah, of course, you guys know my name is Amanda Idusuyi. I come from a very big Nigerian family. So, just starting it all out, like family is very important to me and is actually the inspiration for why I even went into pharmacy school. I do have three older sisters who are also within pharma doing different things. And my father is also a pharmacist as well. And then, kind of going into why I'm in commercial within pharmacy, within the pharmaceutical industry comes from my mother. She's an entrepreneur. She is does a various numbers of different tasks. She wears a lot of hats, and she's always been my inspiration for why I wanted to do amazing things in the world. And pharma and being in pharmacy has always been something that inspired me within my own family, coming from that background of always wanting to, help others, inspire others. And so one of my greatest achievements is starting the Sisters in Medicine, which is something that me and my sisters do on various social media platforms. We focus a lot on patient education, patient wellness, and just educating the masses on a ton of different health topics. So that is a little bit about me, why my interest is in pharmacy and some of the things I do outside of pharma, but still within the same realm and scope of science.
I love that. Well, you said a lot that we can unpack. Your mom's an
Yeah.
entrepreneur, which is great because I'm also an entrepreneur myself. I'm
Yes.
also in pharma, so we have
Exactly.
that. But I love the fact that you said you and your sister started Sisters in Medicine. I want to
Yes.
hear more about that. But before we get to that, can you tell people what is a pharmacist? Because I think people have this idea of a pharmacist is a person who gives you your medication when you go to Walgreens or CVS. But what is a pharmacist?
Yeah. So, of course, everyone has that idea that a pharmacist is someone who's kind of stuck behind that counter. But when you ask me that question, a pharmacist is a lot of things. There's someone who can do a lot. There's someone who has a wealth of knowledge and is really versatile. I think what I would say a pharmacist is a health professional that connects the community to a wealth of health knowledge. And that doesn't always mean behind the pharmacy. That can be within industry, using their insights that they learned in so many years of clinical study, as well as their rotations or their professional opportunities. And that's also in the hospital as well, just being that direct guideline for nurses and doctors, to just understand that clinical knowledge, that drug knowledge that they're able to break down and really get into the nitty gritty with.
I love that. I love that because I think
Thank you.
pharmacists are kind of pigeonholed into
Mm,
one role, right? Like you
yes.
said, behind the desk at CVS or
Hmm.
Walgreens. In the hospital, you may see your pharmacist. You may
Right.
not see your pharmacist. And for our patients who may be watching out there, how can they leverage a pharmacist if they are in a hospital or even if they're going to a CVS or Walgreens?
Mhm. I think definitely the best way to leverage a pharmacist is to come to them with a broad and a wide array of questions. What we learn in school, has a lot to focus on the drugs and breaking down how it works in the body and how the body works on the drugs. But we also learn things outside of that. We learn about different disease states, and I think that's very important with a pharmacist because we are so versatile, and so patients can really come to us at any point. It's not always that you're going to be able to see a nurse or your primary care provider right away. Maybe you can message them on Patient Gateway or My Chart, whatever you use. But a pharmacist is in the community, and there's something that you can use right away. And they'll oftentimes give you a lot of information. They may not be able to give you the full scope, but it's definitely something that maybe they can ease your mind on something that you've been worrying about, or maybe you went on WebMD and Googled. But this pharmacist that's in the community might have a little bit more information than what Google has to offer.
Yes, I love that. I love that. And I think people just need to know that because even as a nurse myself, I love pharmacists. They're like
Mhm. Thank
my
you.
best friends in the
I love
health.
nurses. All my best friends are nurses.
Yes, but I think it's so important for the general public to know that pharmacists are valuable. They're full of information, well educated, well prepared. And
Mhm.
many times your nurses and your doctors are talking to pharmacists, sometimes before they talk to you.
Yes.
So you can definitely
Yes.
leverage, pharmacists, for your benefit. So anyone out there
Mhm.
listening, please have a conversation with your pharmacist. You should know them
Yes, please
anyways.
do. Exactly.
Be proactive about it. So I want to know more about sisters in medicine.
Of course.
What happened to make this come about? Like, what was the precipitating factors?
Of course. So my sisters and I, as I mentioned before, we come from a Nigerian background, and with Nigerians, like I just want to say excellence is built into our DNA. So we always knew we wanted to do something within the medical field, whether it be nursing, whether it be going all the way through med school. But it just kind of came down to the fact that our father was a pharmacist. We kind of got influence from him, and then our mother, seeing the value of a pharmacy degree, really just pushed us all into pursuing that as a career. And then going into it, at first I'm thinking, there's only one avenue with pharmacy. You're going to work at CVS, you're going to work at Walgreens, or maybe a grocery store chain. And then having seen my sisters go through their schooling and then kind of get into their careers, I'm seeing that there are many different avenues that you can take within pharmacy. You could go the traditional route of working at a community pharmacy, or you could do a residency and work in a hospital, or you could enter into pharma and find yourself in a plethora of different areas. So once I started to see that, I was very interested and intrigued with the profession. So it was just really great and ironic that all my sisters were all so close. We're all like best friends. We were like, if we're all going to be pursuing the same career, why don't we, help people? Like, why don't we give not only knowledge about everything we're learning in school, like all the disease states we're learning, all the medicine modifications we're learning, why don't we also help individuals learn how they can get into pharmacy school as well? So we kind of built it from patient education, just teaching the masses about health information, health knowledge, things about common cold and flu, to now kind of switching to still focusing on that patient population, but also helping individuals land pharmacy school roles and helping people gain education, and learn that there are other opportunities within pharma. And we are literally a testimony of that, all of us being in different areas within the industry. So that's something that we've been building since 2017, and we are largely on Instagram with a couple of videos on YouTube, but we definitely want to start taking our information that we've been putting on our main platform and kind of spreading it across all of our socials. But it's something that I hold very near and dear to my heart. It's something I get to do with my best friends every day, and it's also just really great seeing people learn so much from us, people coming to us saying, that video of how to learn how to swallow a medication, that was very helpful to me, or, oh, I never knew that you couldn't take this medication and this medication together. So it's really great taking the knowledge that I went to school for so long for, and then being able to give that back in a real way, not just waiting to work in a job to be able to do that.
I love that, and it makes me think of your mom, right? The entrepreneurial
Yes.
spirit, for you
Exactly.
and your sister starting your own business. I love that. And what's your handle if people want to find out more about Sisters in Medicine?
Of course, it's sisters_in medicine
Okay, on Instagram.
on Instagram. Yes.
All right, I love it. Now you are a Husky. We both graduated
Yes.
from UConn.
Go Huskies.
Yes.
Go Huskies.
Yes. So tell me how you transitioned or how you landed this opportunity with
Of
Sanofi,
course.
which is a pharmaceutical company, and explain to
Mm.
me what a pharmaceutical company is, because
Mm.
people, we have a bad rap
Of
working for
course.
pharma. But tell us how you landed the opportunity, and then just educate our listeners a little bit on what is pharma and why it's so beneficial to everything we do in
Right.
medicine.
I love that. So breaking it down first, so how I transitioned. So I'm currently right now in a postdoctoral fellowship with Sanofi in conjunction with MCPHS. So that's Massachusetts College of Pharmacy, located in Boston. And so basically what a fellowship is it allows professionals, not only Pharm.Ds, but sometimes MDs or whoever, to break into the industry. And so what I'm doing, or my specific specialty, is commercial strategy. And so within that, I felt that was very aligned with my skills of, what I've learned in school, and then also with my extracurriculars like Sisters of Medicine, because I'm doing a lot of patient marketing. I'm doing a lot of patient education in the realm of rare disease. And so that's something that I've said, I hold very near and dear to my heart, is getting that information out to patients. And with rare disease, it's not really always pushing the medication. Is what I like so much about it, is it's actually pushing the disease state and teaching people about the
Mm.
disease state. Because the thing with rare disease is that you may not even know that you have been dealing with this disease, because it's such a small amount of people that suffer from it. It's such a small amount of people that even know what the signs and symptoms are. So I think
So
that it's really
really
important. Oh, can you hear me? I don't know if I'm echoing.
I
I
can
think
hear
that
you.
it's perfect. I think that it's really important for me, entering into this career, to be able to continue that patient education, to be able to be that bridge between, or that gap between clinical and the business aspect of pharma. So that's my transition. I'm doing a 2-year fellowship. It was a program that I applied to through MCPHS. There are many fellowship programs that people can apply to throughout the country, but I'm very happy to be at this one and to be working at Sanofi. I love that. I love my job. And then the next question you had was, what is pharma, and how do pharmacists, or what do we do within pharma? So I kind of already broke that down a little bit of what I do. But I would say that pharma has a lot of different avenues. And I think that's why I was also drawn to it. It just has so many different things that you can do. You can find yourself in so many different careers. Like for me, within commercial, I know that I love patient education. I know that I love patient advocacy. So that's something that I'm gravitating more to. Some people, may want to focus more on changing the minds of healthcare providers, getting that medication to be seen. Maybe there's a better one to be prescribing to patients. And, some healthcare providers might be stuck in their ways with prescribing, what they've known all this time. So I think that there's different things that you can do within pharma, and that we do get a bad rep, but I think for the most part, we do have the best interest for the patients, and for healthcare providers alike.
Yes, absolutely. Because even Tylenol, it stems from
Yes,
pharma. If research had to
exactly.
be done in order to get that Tylenol on the shelf, into your house, into your mouth, right,
Exactly.
to reduce your pain or your
Exactly.
fever. I just don't think people
Exactly.
understand the process of, getting medications approved,
Yeah.
um, for patients. And you said rare disease. Can you break that down a little more for us? Because we know what that means, but like
Mhm.
people listening, what is a rare disease?
Right. So rare disease, I can't go really into the specifics, but I can say over as a broad term, rare disease is a disease that only affects a small amount of people in the world. And so something it's not very known to many people. It's not like a COVID, or even it's not even like a cancer, or there are some rare diseases within cancer, but
Mhm,
it's a
mhm.
disease state that not many people know about.
Yes, I love it. I love it. So Amanda, what's your ultimate goal? I mean, the world is your oyster. Like where do you see yourself going? Where do you want to end up?
So, I mean, aside from pharma, one of my passions is motivational speaking. It's something that I love doing. And your podcast is something that when you asked me to be on, I was so excited because it's in line with my insights as well. I love giving back to others. I love feeding back into others. I love elevating and inspiring people. And I think that's something that has come from my upbringing of having so many wonderful women be, inspirations for me, whether it be my sisters, whether it be my mother, my aunts, my grandmother. Everyone has had some type of influence on me. And I like having all of that wealth of knowledge. I like having all of that wisdom and being able to pour that back into others. So I, as like a career goal, I mean, of course I'm in pharma now, but as something that I'm very passionate about is being able to get to the next step of becoming a motivational speaker.
I love it. So you don't have
Yes.
to wait. You're already there. All you have to
Thank
do is
you.
find a platform, put your camera
Exactly.
on and start
And
talking.
speak. You're so right.
Yeah,
Especially in
yeah.
this day and age with technology, it's really that. So that's something that I will be seeking into, finding my way into now that I'm done with school. I can focus on my career. I can focus on my extracurricular endeavors, and I'm very excited to move on to the next step of this life.
Yeah, and that's what I tell, a lot of people. One thing I learned with COVID is that, as healthcare professionals, we define ourselves very
Of
much by our
course.
titles, right?
Mm.
Because we work so hard to get them,
Yep,
right? We
exactly.
go to school, the stress of finishing school and taking the exam and getting certified and all the things. However, what I learned with COVID is that the titles and the job titles, the letters behind your name and all that does not define us.
No.
It does not define us. Who we are at the core, that's who we are at the core. So motivational speaker, you are already a motivational speaker. We just need to
Amen.
get you out there to start talking to people and start motivating people.
That's
But
so
I think
true.
sometimes we spend so much time in our careers, and I think it's great that you're saying this now, like so
Hmm.
early on in your career. So I look forward to being on your show or being in
Of
the audience
course.
listening to you.
That's awesome. Thank you so much.
Speaking. Yes, absolutely. Let's make it happen. Let's make it happen. So, Amanda, before we get out of here, what is something you want our audience to know about you or Pharma or what you're doing? And this
Uh,
is, I'm going to give you some time on here to motivate our audience, and I'm going to
okay.
step off.
Okay. Definitely something that I want to give back to all of you is just find what works for you. Find what works best for you. I think when I started pharmacy school, I had everything figured out. I knew I was gonna do community pharmacy. I knew, and I kind of was like setting a blueprint for myself. But along the way, I started, seeing different things. I started experiencing different things, and I realized, what fit best for me. I started noticing things about myself that were more in line with other careers or more in line with other extracurriculars. And when I felt that passion, when I felt that thing that mattered most to me, that is what allowed me to know and understand exactly where I needed to be. I kind of just let myself grow in the way that would allow me to experience different things. So I definitely, what I would say is try things. Put yourself out there. Don't be afraid and don't be shy or nervous to try something or to reach out to someone or to speak to someone, because you never know what the next opportunity will hold for you. You never know the next person that will open a door for you or hold that door open for you. So the most important thing I want to say is just be open, be ready, and be excited for the things that life has for you.
I love it. That's a great message. That's a
Thank
great
you.
message. And before I let you go, I do have to do a rapid fire. Are you okay with
Of
that?
course. Yeah,
All
that's fine.
right. So answer the question with the first thing that comes to your mind or finish the
Okay.
statement.
All
So
right.
wellness means
Happiness.
I know I'm stressed when
I'm crying.
my go-to stress management solution is
Prayer.
one thing I learned about myself during COVID is
I'm resilient.
mm, something people get wrong about you.
I'm quiet.
I could see that. I could see that. I could see that. Great. And what do you want to be remembered by? What legacy do you want to leave here on earth?
Sisters in medicine, for sure. I think that that's probably, I couldn't mention it enough on this podcast. I think that I just love being able to help people in a non-conventional way, and use the talents that I've gained, use the knowledge that I've gained to help in a way that doesn't necessarily mean I'm working in my career, just extracurricular. It's for fun. It helps me. It helps others. I'm able to express myself and people are able to learn. So it's a win-win. It's a symbiotic relationship.
I love it. And I'll have to have you and your sisters back to really
Oh,
unpack sisters in
of course.
medicine. Let's
Of
amplify
course.
that. So,
That sounds
Amanda,
great.
thank you so much for being here. And we'll have to have you back.
Of course. Sounds great. Thank you for having me.
More than welcome. More than welcome.